Hello and welcome to The Print. I am Sumi Sukanya Datta, and today we have with us Dr. Govind Makharia, Professor of Gastroenterology with the All India Institute of Medical Sciences in Delhi, who is going to speak about celiac disease. This month, the first Asian Pacific Celiac Disease Symposium was organized at the All India Institute of Medical Sciences. Welcome to The Print, Dr. Makharia. Please tell us about how big the burden of celiac disease is in India, and which is also called gluten intolerance sometimes, and how it is characterized.
Thank you so very much first, and my greetings to all of you. Celiac disease is now becoming an important disease. Sometime back, it was thought to be a very uncommon disease, but now we know that globally, 1% of population have celiac disease. 1% means 1 in 100. Now, it was also thought that in India, we don't have celiac disease, it's uncommon. But we have seen over the last 20 years and with multiple studies that 1 in 140 0.6% people in India have celiac disease. So that is 1 in 140. It's more common in northern part of India compared to southern part of India.
And why is that? Could you please explain why is that more common in northern part of the country?
Ethical reasons are not known. Celiac disease requires two factors. One is intake of wheat, and in the wheat there's a protein called gluten. So some people have a gluten intolerance. That's number one. Number two, it happens to only those people who have a genetic predisposition to this disease. So the two factors are there required. So in northern part of India, the wheat intake is remarkable, quite large. In southern part of India, wheat intake is less. That could be one reason that celiac disease is less common in southern part of India. But we also know now that with modernized of society, the wheat intake or wheat consumption is increasing in every part of our country. Therefore, it's also possible that in coming time, we will also have a celiac disease in southern part of India. That could be one valid reason for less frequency of celiac disease in southern part of India. Uh, because it is also likely to happen that wheat intake is increasing all over. And even in southern part of India, even small children now are exposed to wheat, which they were not earlier. So celiac disease may also emerge in southern part of India. Why I say so? Because for celiac disease, you require to have some the specific genetic predisposing factors, which is present in southern part of India, another part of India. Therefore, in coming times, is likely that we like start seeing patients with celiac disease in southern part of India also.
Okay. So, are you seeing that the numbers of celiac disease patients is increasing? Also, how exactly is the disease diagnosed? How does a patient know that they have celiac disease, for example?
First of all, the number of patients are increasing. The increase is because of two reasons that you're making more diagnosis, right?
Okay.
Second reason is that the disease is occurring otherwise more. The both factors are there, but I like to highlight the first factor first. That earlier we thought we don't have celiac disease, therefore you will not investigate for celiac disease. Now we started doing investigation, and more doctors are doing tests for celiac disease. Therefore, numbers are rising. And that's the most common cause of increased diagnosis for celiac disease in our country. Because more and more doctors are thinking about celiac disease, therefore, more and more patients are diagnosed to have celiac disease. So, therefore, question comes, when do they think of celiac disease as a diagnosis? Uh, as we know, the celiac disease affects small intestine, where food is absorbed. So if there is a atrophy, if small intestine get diseased because of celiac disease, then food is not absorbed. Once food is not absorbed, they will have a diarrhea. If
Okay.
not absorbed, they will have anemia. खून की कमी होगी. If they have a uh, if they have a no food absorbed, the child will not grow. They remain short stature. So there are and weakness. There are most important symptoms of celiac disease. That's chronic diarrhea. Somebody had diarrhea which is going on. somebody has short stature, somebody has anemia. So these are the most important features of celiac disease. There are many others, but these are the most common cause. So anybody who has these symptoms, the doctors start testing for celiac disease, and therefore
Okay.
we have increased numbers now.
Okay. So how does it affect, because you said many children who have this disease have diarrhea. So how does it affect their, the growth pattern in children? And also how are adults impacted? Because, many a times only when people are in their adulthood are they actually, I've seen some cases like that, who are actually diagnosed with celiac disease when they are fully grown adults.
Sumi, this is a fantastic question. Earlier, people believed that celiac disease affects only children globally, world over. Therefore, these patients were seen only by pediatricians. And all doctors around the world uh, treating adult patients, they thought celiac disease doesn't occur in adults. We all forgot the child will grow one day and become adult. If I don't diagnose this individual in childhood, the same person will come to me in adulthood with celiac disease, with same manifestations. So celiac disease is a lifelong disease. We can diagnose in early part of life or later part of life. But onset generally occurs in early part of life. Those we miss to diagnose in childhood, we diagnose in adulthood. This is number one. Why it happens, and this is again very interesting, that the wheat or barley, wheat is and barley is jaw, wheat is gehu. So these two have protein. Every grains have protein. So in these two grains, the protein called gluten. The gluten protein is not digested completely in our GI system. Therefore, they remain peptides. And these peptides induce immune activity or immune reaction in certain people who have a genetic predisposition. And this immune activation kills the small intestinal cells, which help in digestion. So as long as you keep taking wheat, the whole process goes on and on. Therefore, the intestine get damaged and food is not absorbed. As you stop taking wheat or jaw or barley, the immune system is silenced and activity goes down, intestine regrow, and everything gets better. So therefore,
Yeah.
early part of life, if you don't have food, child will not grow. And food means if food is not absorbed because of disease of intestine, the child will not grow, and therefore they remain short height.
Yeah. So, can you also talk about the advancements in diagnostic tests and criteria for accurate celiac disease classification? Are there classification for celiac disease, or this is just one kind of disease for everybody who has this?
I think celiac disease is fortunate that now we have blood test like blood
Mhm.
sugar, like so a simple blood test uh, it's called anti-TTG antibody. This test is a great test, and this test is indication. So if I suspect celiac disease in my based on symptoms, do a blood test called anti-TTG antibody. And if test is positive, then we need to do endoscopy to confirm that there is also damage to intestine, right? And this is how we make a diagnosis of celiac disease. So think of celiac disease, do this blood test, do endoscopy, and confirm there's enteropathy. And ever since we have advancement in terms of these blood tests for last about 20-25 years, the number of celiac disease have increased world over because we can diagnose just by blood test.
Okay. So, what are the emerging? Are there? What is the main line of treatment for such patients? And also, are there any emerging therapeutic strategies that these patients can benefit from?
Yes, the simplest and the best method of treatment is a gluten-free diet, means wheat and barley-free diet, because this wheat protein i- induces immune activation and damage intestine. So in those patients with celiac disease, this is the only treatment available this point of time that stop wheat and wheat products completely, total. It's not about decreasing, it's total. And this is the most effective treatment at this point of time world over. It's fantastic that only diet can control this major disease. Certainly, while diet can control major disease, but to maintain adherence to gluten-free diet is not easy. It's challenging, and for that, counseling is important. And anybody who diagnosed celiac disease should counsel patient and family how to remain gluten-free in the school, if they travel, if they go out of the home. How do you maintain gluten-free? And this one's own conviction that I want to be gluten-free, because our society will not provide gluten-free food. If they go to different towns, there's no food available. But I should prepare myself that I'm celiac disease, and therefore I need to be gluten-free. So I need to prepare myself for this. So this is the most important aspect of celiac disease. Gluten-free diet, consult them properly, and patients should adhere to gluten-free diet. One of the beautiful thing about celiac disease that we now know why this disease happens. Every step is crystal clear, and therefore, once every step is clear, we are able to invent new drugs. So at least 7 or 8 targets are being explored. 2 targets are under clinical trial, advanced clinical trial, and hopefully in
Mm-hmm.
coming years we'll have a new drug for celiac disease.
So when
But
you say a new drug, does it mean that patients can then they can continue to have wheat and barley, the food with gluten, and have the drug, and they can still be okay with it? Does that what it mean?
I knew this question is coming. So yes, everybody has this question that if a new drug comes, can we go normal diet? Less likely, because these drugs, unless we have little more understanding about this, but these drugs will not allow you to take wheat completely. So whatever
Okay.
is a gluten-free diet, many of us are exposed to small amount of gluten, and this drug will help digesting that small amount. Also, there are a lot of advancement like immune system suppression, the new advancement, which may allow some point of time a normal diet. But again, we don't have any idea at this point of time. At this point of
We don't
time,
have a timeline yet.
we don't have timelines yet. Yes, you're right.
Yes. Yeah. Okay, sir. Thank you so much for your time and this insightful conversation. Thank you so much for joining us, sir.
Thank you so very much. God bless. Bye.
Yeah. Thanks.